Mulubinaka everyone. I hope everyone has a mask or has made a capable substitute. Importantly, I hope you're wearing it every time you leave your house. In a taxi, on a bus, in the supermarket. If you are not at home, please wear a mask. I want to thank all those who have adopted this life-saving habit. Please help us encourage everyone to follow your example. Not only wear a mask, but do it properly, with your mouth and nose fully covered. So essentially, when you're putting on your mask or when you're taking off your mask, we ask that after you have sanitized your hands, you just hold the edge on the side over here. Don't hold it in front. You take it off like that. And then when you put it back on, put it on like so. And you just press the wire in the top. That's it. So that when you're looking at it, the mask should actually cover your face quite nicely along the nostril. Now, just for the purpose of this press conference, I need to take off my mask in order for me to express myself more clearly as regards to what I'm going to say today. I came into this room with a mask on today. Now that I'm properly physically distanced from everyone, I have removed the mask so that I can be understood clearly by the public. We asked everyone in this room to have a Care Fiji app downloaded on their phone and to make sure that it's switched on. Once I'm done speaking, my mask will go right back on so that I can protect myself, my loved ones, and my country. This virus, it can travel through the air and through tiny droplets from person to person within close distance. The more Fijians wear masks and wear them properly and adhere to the physical distancing, the better chance we have of becoming COVID contained again. I want to begin by clarifying some of the restrictions that we announced yesterday. High-risk businesses have been closed throughout Vitilevu, including in Nandi and the Lotoka containment area. We are widening that definition to include all the following: gyms, movie theaters, video gaming shops, cyber cafes, taverns, bars, billiard shops, and amusement arcades, as well as the hairdressers, barber shops, spas, beauty therapy, massage therapy venues, saunas, and tattoo parlors. The nature of these businesses mean they cannot operate with proper COVID-safe protocols, including enforced physical distance of 2 meters. They should all close everywhere in Vitilevu for at least 14 days. The suspension of international passenger travel takes effect from midnight tonight, with the exception of Fijians traveling for medical purposes and other passengers as approved by the Office of the Permanent Secretary of Health and Medical Services. Testing and contact tracing has continued throughout last night and into today. And I want everyone to know, from the very start of this conference, press conference, we have not identified any new cluster of cases in the community. We are still with the same cluster. I need to emphasize that point. We have confirmed that 2 of the children living in Wainitarawau Settlement are positive for COVID-19. A 7-month-old son and a 14-year-old daughter of the 40-year-old that I announced yesterday. These 2, along with their mother, father, and 3 other children, are all in fine health in the Tavua Hospital Isolation Ward. Both children initially tested negative for the virus on Tuesday, April 20th, the day they entered isolation. That gives us a high degree of confidence that they were latent cases which means that they entered isolation before they became infectious. So, while the 14-year-old did attend school on Monday, April 19th, we believe there is little chance that she passed the virus to others. However, out of an abundance of caution, we will be running a screening exercise based on the daughter's movements. I want to remind everyone that we identified this family because they made the patriotic decision to come forward and because they were honest with us about where they had been. Now, they will be getting the treatment they need, and they will no longer pose a risk to others. They deserve our thanks and nothing less. I've said before, we need to erase the stigma around COVID-19. The virus is the problem, not any one person. We have to, at all costs, protect the privacy of Fijians living with the virus. As a ministry, we rely on information to contact trace. And there's absolutely no benefit in putting the identity or the information into the public space. We're talking about children here, some of the most vulnerable members of our society. They're anxious, they're scared, and the last thing they need is for their privacy to be violated and their information to be blasted out online. The stigmatization of Fijians living with COVID-19 has very real consequences. When bullies online take advantage of other people's suffering, Fijians who should come forward may be scared into hiding their travel history or hiding their symptoms. That culture of stigmatization can put the entire nation at risk. So please, join me in saying thank you to this family, to the drivers, to all those that came forward as potentially having been exposed to the virus. And if you know you had exposure to someone living with COVID-19, please tell us. Call 158. And stay home until our teams can check on you. Do it for yourself, do it for your family, do it for Fiji. We have collected samples that will be tested for 200 people who attended the funeral at Tavua. We have not confirmed any new case at this point in time. However, the window of transmission is still open, and our contact tracing for the funeral continues. So, this result may change overnight. Nasomo in Tavua has also been identified as a screening zone based on the movements of the case from Wainitarawau, Cunningham, after the funeral. The same rules established for Wainitarawau Settlement apply here. No one is allowed to leave. Those who reside in the community may return, but they must stay there for at least 14 days. We are still looking for the minibus driver who drove the hotel staff on the evening of the 17th of April from Lautoka City minivan stand to Nandi at around 5 p.m., as well as the passengers of that minibus. After our investigation into the travel history of the mother in Wainitarawau Settlement, we are expanding our contact tracing to individuals who are at Saweni beach from 10 a.m. to 3:30 p.m. on Saturday, 17th April 2021. If you are at Saweni beach during that period, please call 158 right away. Stay home until the ministry can check on you. We also have 6 new border quarantine cases. One is a 38-year-old gentleman who arrived from Malaysia on the 8th of April. The other 5 are members of a family that arrived earlier from Philippines. 2 of those members of the same traveling family had tested positive during entry testing, and this was already announced on April 17th. All these individuals tested negative on arrival. They did not test positive until the very end of the quarantine period. This is compatible with what the science tells us, that this virus can take up to 14 days to present itself, which is why we use the 2-week time frame as our containment window. In total, there are 19 active cases of COVID-19 in Fiji. That is the highest number of active cases that Fiji has ever registered. 14 of these cases are at the border, and 5 are what we call locally transmitted cases. I just need to be very clear, they are locally transmitted. That means we know how they got the virus. Community transmission is when the case is present and we don't know how the person got the virus. Here we know how they got the virus, so we can track and we can contain. Around the world, these sorts of increases can signal an exponential rise on the horizon. While most of our cases are at the border and the rest are securely in isolation wards, we still have to be prepared for that possibility. Our testing lab is running 24/7, and we have substantial quarantine and isolation capacity available that is currently being expanded as a precaution. I hope to see our own precautionary steps shared more widely, particularly in the media. Last year, the media, for most part, were our ally in the COVID-19 containment strategy. We saw fact-based reporting that helped get Fijians good information. And it was a big reason why we succeeded in containing our outbreak. But unfortunately, we've seen a troubling shift towards sensationalization from some of the outlets. We've seen reporters stalking our health officials, following them into high-risk areas. And the worst thing is that they rush to publish half-baked stories with zero context from official sources. Yesterday, Fiji TV and Fiji Times trailed our health officials and members of our discipline forces into what would later be established as a screening zone. Before we could make the medical assessment that would close off the area, these reporters were in the soon-to-be screening zone, speaking with people on camera, filming people's homes. These reporters not only put themselves at risk due to this highly transmissible virus, that means that their families and the country at large could be put at risk as well. What these reporters have done was wrong. Morally and ethically, it was wrong. From a public health perspective, it was wrong. And it interfered with the good work that the ministry is currently doing. Folks, this isn't reality TV. We're dealing with an outbreak of a very deadly virus. Anyone who spends their time shoving cameras, recorders, and mics in the faces of potential COVID patients could end up becoming a COVID patient themselves. And by doing that, you put more strain on the Ministry of Health. We give these updates every day. We are transparent with every action we're taking. So I'm asking, please respect the work we are doing. And wait for our official updates. Once we have made sure that the facts are established and we've cleared up the context for the nation of Fiji to read and understand. Don't be reckless with your well-being. Don't be rash in your reporting. Lives will always depend on your responsibility. Ladies and gentlemen, a shipment of 26,000 doses of COVID-19 AstraZeneca vaccines is in the country. We have amended our deployment schedule in light of the current health restrictions. So starting from tomorrow, individuals will be called to come forward on a set timetable to reduce crowding at the administration sites. Our main focus is in Nandi due to its close proximity to the airport and quarantine facilities. We will be calling Fijians living with underlying health conditions that increase their risk of severe disease if they get COVID-19, as well as those working in high-risk professions, including retailers, hotel staff, drivers of taxis, minibuses, and buses. Members of the media in Suva and in the West, as well as parliamentarians and parliamentary staff, will also be called to come forward and be vaccinated. With these vaccines made available to these groups, the Ministry's advice will soon be that media conferences in confined spaces such as this one here, as well as in parliamentary sessions, will only be open to partially or fully vaccinated individuals. I want to end by applauding the businesses that are opening today with proper COVID-19 safe protocols in place. Staff are masked, physical distance is being maintained, and all employees and customers are urged to download the Care Fiji app, switch it on. Care Fiji has been downloaded more than 148,000 times as of today. But we need more. We need everyone who has the app to keep it turned on. It will speed up contact tracing. It will save lives. If you're working or shopping anywhere, you feel COVID-19, where you feel that the COVID-19 protocols are not being followed, let us know. You can report your concern to Fiji Competition and Consumer Commission over email at helpdesk@fccc.gov.fj. Thank you to all those Fijians who are doing their utmost to aid my teams in containing the spread of this virus. Also say thank you to the businesses who lent the ministry vehicles and drivers to speed up our contact tracing. It is in the best interest of every business in Fiji that we contain this outbreak quickly. And we look forward to their cooperation and whatever support they can offer. We also like to thank those who are sharing our advice on your social media pages to spread our messages across the country, especially our friends in the Fiji tourism industry. We cannot say how long it will take to defeat this virus, but the sooner we embrace the role that we must play in stopping the spread, the sooner we will all adhere to good habits like mask wearing and good hand hygiene, physical distancing, and the more time we all spend at home, the sooner Fiji will triumph over this virus once again. Do your part. I can assure you, every doctor, nurse, lab technician, and member of our discipline force will be also doing this. Thank you.